In the humid hush of a Javanese night, a cry rose from a small clinic, and the room froze. A baby had entered the world with two faces. His name is Gilang Andika. One body, one skull, two moving faces sharing a single head, and, according to scans, additional brain tissue from an unborn twin. Doctors warned of a second, quieter enemy, hydrocephalus, fluid pressing on delicate brain structures that without treatment can steal sight, breathing, and life itself. How does a child like Gilang come to be? In the earliest weeks after conception, when the blueprint of the face and brain is laid down, something diverges. Some physicians describe his anatomy as a rare form of conjoined twinning. Others call it Diprosopus, craniofacial duplication, an anomaly so uncommon it's scarcely seen even once in a career. The result is heartbreaking and astonishing. Duplicated facial features on a single head with portions of neural tissue that don't fully integrate. To the untrained eye, it can look like illusion. To surgeons, it is anatomy rewritten. For his family, there is no vocabulary grand enough to hold the shock. They did not ask for wonder or horror. They asked for a child. But the world arrives at their door anyway. Curious, afraid, sometimes cruel. Cameras search for spectacle. Doctors search for options. Can a shunt relieve the hydrocephalus? Can he feed and breathe safely? Could surgery ever separate, reshape, or choose a single face without destroying the brain beneath? The honest answer is that survival itself becomes the first objective. Hydrocephalus is time's sharpest blade. If cerebrospinal fluid cannot drain, pressure rises, the skull expands, and brain tissue thins. A neurosurgeon can place a ventricular shunt, tunneling a thin tube from the ventricles to the body so fluid can be absorbed elsewhere. It is not a cure, but it can win days, months, sometimes years. Time for lungs to grow, for infections to be fought, for feeding to stabilize, for love to do its quiet work. And then there is the question no monitor can answer. One mind or two? Two faces may open their eyes, blink, grimace, even suck. Reflexes can ripple through duplicated nerves like wind through grass. But do those movements represent one integrated awareness, or parallel sparks that never become a flame? EEGs and imaging can hint, not tell. Each small response, turning to a voice, calming to a song, becomes its own fragile data point in the mystery of personhood. History keeps a thin ledger of children like Gilang. A handful of infants with facial duplication have been recorded across centuries. Most die in the first days from breathing or heart complications. A few live long enough to be named, blessed, mourned. Their stories were taken by sideshows, by tabloids, by cabinets of curiosity. Our channel rejects that bargain. We do not come to exploit. We come to witness. So witness this. A mother holding two profiles against her chest and calling them by one name. A father learning the geography of hospital hallways, tracing prayers into the creases of his hands. A team of surgeons arguing with nature and risk on a whiteboard at 3 a.m., weighing shunts and sedation and the hard math of oxygen and time. Somewhere between miracle and medicine, a child struggles to stay. Gilang's condition is rare. Some estimates say 1 in a quarter million for conjoined twinning, while true Diprosopus is rarer still. Numbers offer context, not comfort. What matters now is vigilance, preventing infection, protecting his airway, treating seizures if they come, and giving his parents the one thing science can never prescribe: hope measured in hours than days. If you are hearing this, remember, behind every headline is a heartbeat. Gilang is not a spectacle. He is a patient, a son, a life unfolding at the edge of what medicine knows. And whether his story lasts a month or a decade, it deserves dignity. Some will call him a miracle. Some will brand him a monster. He is neither. He is a child suspended in the narrow space where biology misfires and humanity is tested. If a shunt can turn back the pressure, if feeding can be secured, if infections can be kept at bay, then every sunrise is a victory, every breath a small defiance of the odds. This is History of Abnormal. In our next chapter, we follow the fight to relieve the pressure inside his skull. the ethics of intervention when surgery can save a life, but not erase a face, and the unanswerable question whispered over every crib in intensive care. What makes a person a person?